Hi,
Hello.
nice to meet you. I'm Dr. Ritchie. I'm one of the doctors
Right.
here. I understand you want to have a chat about your dad.
Yeah.
Before we go on, can I just double check that I know who I'm speaking to?
Yes, I'm Mrs. Roberts. I'm Anne Roberts. Mr. Spencer is my father.
Okay. And how can I help you today?
Well, I mean, he's very confused, so he's not likely to be able to talk to you himself, but I'm worried about his feeding at the nursing home. I mean, he's just not getting sufficient food. I mean, they do liquidise it, and he's difficult to feed with the dementia. And I think they possibly give up fairly soon if he starts knocking them off and things. It's been better in hospital, but I was wondering, I'd read somewhere about you could feed with a peg.
Okay.
And I was wondering if this was possible, because when he goes back, the same thing's going to happen again.
Okay.
But I equally can't make too much fuss at the nursing home
Because they're looking after
the
him.
next thing is they'll turn around and say, well, he can't stay here.
Okay. I understand your dilemma. That's an awkward position for you to be placed in. So from what you've told me, I understand that there's a diagnosis of dementia.
Well, vascular dementia, yeah.
And do you understand sort of how advanced it is or how severe it is in him?
Well, I don't understand medically, but he's very variable, but he doesn't usually know you.
Okay.
Or he thinks you're somebody from the past, you know.
Yeah.
Sometimes he's a bit violent in that he'll push people away and this sort of thing, which is what I think's happening with the food.
Okay.
That he doesn't want it, he doesn't like liquidised food, and I think he's pushing them
Becomes a
away.
bit
And
aggressive because
sometimes
of that,
they're giving up on him.
Okay. And in relation to the dementia and his ability to eat, has anybody talked to you about how those two things relate to each other? Obviously, you've got some sort of knowledge because you know about some of the feeding options.
Well, I don't only know that not because they've told me, but I looked it up on the internet, what you could do about, people who couldn't feed.
Yeah. So as part
I don't know about the link between it, no.
No. Okay. Well, as part of advanced dementia, which is what your father has, sometimes people will, in essence, forget that they need to eat. You've mentioned that he forgets names and faces.
Yeah.
And you then begin to forget other things that
Yeah.
you're hungry or that you should be eating. Now, this is an alarming feature because this is a warning to us that the dementia is becoming quite well advanced and it is a very marked problem for him. When we think about treating people, we've got to really think about them. And you're right, it's not our job to try and make life easy for the nursing home. It's to try and make life better for your father. And I think that's the most important thing.
Well, there's both really, isn't there? Because if the nursing home is understandably largely giving up, he's not getting enough food, and from his point of view, he's getting upset about being fed. So it's him as well.
So one drives the
it's
other.
both sides. Yeah.
My main focus in what I'm going to say is going to be on your dad.
Yeah.
So and his overall well-being, and what we always have to consider when we're proposing doing something to a person is what are the potential benefits and are there any potential harms or risks, and where does the balance lie? If there's more harm than benefit, then something doesn't sound like a good idea, and if it's the other way around, it obviously would sound more attractive. A peg tube is...
I don't really understand what a peg is. I've just read a sentence that said
that says they exist.
Peg feeding can be considered.
Yeah. Now, a peg tube is, in essence, a feeding tube that's placed through the stomach, and it comes out through the skin. and people can be given some form of nutrition through that.
Yeah.
Obviously, placing one of these is a challenge. It's not a straightforward procedure. It's not like just putting a drip up on somebody. So we have to consider the fact that actually doing this has risks of complications. And in that scenario, where placing it could cause distress, discomfort, or even harm to your dad, we'd really have to be very convinced that doing it would afterwards lead to a lot of benefit.
So
do you
how
understand where I'm
great
going
is
with
the
that?
risk?
The risks associated with placing a peg tube are relatively small. However, in someone who is elderly, has dementia, and as you know, he's come in hospital at this time with a chest infection, they are magnified. So
Is it an anaesthetic job? Or?
it's possible, if you've mentioned that he can become agitated,
Yeah.
especially when people try to feed him, he may need an element of sedation, and sometimes they are placed under a general anaesthetic, which does have larger risks. So if we accept that there are some risks associated with placing it, we've got to ask ourselves, are there any benefits? And I think we could break that down into two ways. Firstly, is it going to make your dad feel any better? And I think the answer there is no. What we've said already is that because of his dementia, he doesn't realise that he's hungry, so there's no distress caused by the feeling of hunger as you or I might have when we're starving and we're really desperate to get something to eat. That's not something that's affecting your father and affecting his state. The second part of looking after your dad, so if it's not going to make him feel any better, we have to ask ourselves, is it going to make him live any better or live any longer? And we have quite a lot of experience in this, not just here but globally there's interest, and it's quite clear that placing one of these feeding tubes, although it's a very logical idea, it does not make people live any longer. This is most likely because, as we said, when you get to the point where you forget that you're hungry, the dementia is at such an advanced stage that other complications like this pneumonia are going to arise. And it's not the nutrition that's the most important thing, it's these factors that overtake it. So when you look at that balance, if we say placing this has an element of risk, even then it's not going to make him feel any better and it's not going to help him live any longer, then at that point I think we would suggest this doesn't sound like the right thing for your father.
No, that's fair enough. I just thought I would raise it. The only thing is that brings me back to the nursing home. If he's not getting enough nutrients and things, yeah, I mean, you said he won't know and it won't affect him. But I mean, is that really true that you can go without food?
Ultimately, without food, you will not survive. However, your father has a disease that's advanced so far, and we really do have to view dementia as a life-ending condition.
It sounds dreadful, but in actual fact, it wouldn't be a bad thing if it did bring the end nearer, because he's no quality of life.
That's one factor definitely to
But
consider.
It's just that you've reassured me a bit. I thought him not eating would be very uncomfortable for him. You know, if we're hungry, we need food, don't we? And I hadn't sort of realised that he doesn't feel hungry.
I think probably what the best thing to do is to involve the dietitians locally. Maybe they'll be able to explain to you better some strategies that can be used to help feed people with dementia in a way that doesn't upset them or agitate them. And perhaps then they could feed back with the nursing home so you understand what they're doing a bit better. That way, hopefully you'll understand
Yes, please,
that they're trying to help,
a good idea.
and that they're not trying to give up on him because it's a challenge.
Yeah.
Is that okay?
Yes, that's fine. Thank you.
Thank you very much.
Thank you very much, Dr. Ritchie. I'd just like to talk about a couple of points that came up in that conversation. The what was it initially? She brought up peg tube. What did she understand by peg tube at that point?
I think at that point she knew that it was a means of feeding people, but beyond that I think she had very limited knowledge and understanding.
Okay. Go on.
So in essence at that point I wanted to establish the background, and then before I got the chance to ask her what she knew about a peg tube, she volunteered the fact that she knew very little.
Very well. Now, the sentence that she said, it wouldn't be a bad thing if it did bring the end closer. Do you think that was an easy thing for her to say?
No, I suspect not. I'm clearly with an elderly gentleman who's got advanced dementia. This has doubtless been going on for some time.
Yeah.
I suspect this is a diagnosis that ultimately she's become to accept. But despite that, that's clearly, probably a big step to make.
Yes, yeah. You also mentioned that there are other strategies. So we sort of spent a long time talking about peg feeding and how ultimately you feel it's not going to do him any good. But you mentioned that the dietitians and other people. So what kind of strategies do you know of?
Well, I think there are options for enriched foods, so calorie-enriched foods and drinks. Thickened fluids may be an option. And beyond that, I think what you've got to probably think about doing is trying to find ways of feeding him, whether it be whole meals and sitting down or regular small snacks, smaller sort of feeding intervals to try and just get calories in. And also exploring meals and environments that he's comfortable with. So he's in a nursing home, but you've got to question, is it familiar enough to him, the dining setting, that he can respond to that and appreciate he should be eating.
Yeah, okay. Is there anything else you would have done differently, or anything you'd like to add?
I think had there been more time, it would have been appropriate to begin to explore the longer term prognosis. In a man with this degree of dementia who's been admitted into hospital with a very severe sounding pneumonia, I think his life expectancy from this point on is very short. So I think at that point beginning to discuss the prognostic implications and questioning whether it's right to bring in end-of-life planning with her would be appropriate.
Yeah. And so, for example, further hospital admissions?
So further hospital admissions, further antibiotics, place of death.
Okay, good, thank you. I thought that you did very well. I think it was you did introduce yourself well. You showed a good level of empathy, although I think then there were a few cues that she gave you which you didn't perhaps pick up on. And I would say that if a daughter says about her father, who she's clearly devoted to, that it wouldn't be a bad thing if they died, I think that probably warranted a bit more of a response from yourself. And I think it would have been, because that's a big thing for someone to say. She didn't make it sound like it was a big thing, which is perhaps why you didn't react to it. But I think that's, when someone's been driven to say something like that, first of all, I would say they're quite justified to say that, and I think saying, that's obviously and acknowledging that it's a big thing that they've just said, but it's not a bad thing. I think a lot of people would feel very guilty for thinking that that they're bringing their father closer to death would be a horrible thing, and they're a horrible person for thinking it, and maybe even criminal. So for them to have said it is probably quite a big event for them. I did like your the language of, are they going to live longer or live better? I think that's a good way of describing it. And I agree with you. I think this is an opportunity to do some advanced care planning, and to not only say, he can eat what he likes when he likes. And sometimes the difference is it's the food he's being given, and bringing in sweeter foods, or he might be a pork pie man, and so just bringing in foods that he would really like is more important. And perhaps explaining that better to the daughter, that at this stage his use of calories isn't huge. I dare say he's not going out walking and running around and things like that, so he's not going to be using a lot of calories. So it's not as important to get those calories in. And sometimes forcing him to eat when he doesn't want to is just going to be distressing for everyone, accepting, okay, so he can have a little bit of what he fancies when he fancies it, and providing those sorts of food and comfort eating, and accepting that because what has happened here is clearly it's an aspiration pneumonia, and saying, right, well, that's going to happen, and everyone needs to be prepared for that. But we're not going to cut his throat in order to prevent that happening again, and making sure that everyone's happy with that. And I think talking about his what's probably going to be an imminent end of life, that he's at least in the last 6 months of his life now, and that's right, a peg tube won't extend that and may even shorten it. So good.
Thank you.
Okay.